The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening and welcome to BronxTalk. Now in its 17th year, one of the longest running television talk shows in the city of New York. You can join our conversation tonight. You can call in at 718-960-7241. You can also email comments to us at bronxtalk@hotmail.com, and we'll read those on the air during a future edition of our program. Well, the Obama administration hailed the passage of the health care reform bill as a crowning achievement. Others think the bill didn't go far enough to truly reform the system. Still, others think it's so expensive that it'll bankrupt us all. Regardless, the reform is here, and it's our judgment that too many of us don't even really know what's in the reform bill, how it might or might not affect our health care, and what it will cost us individually and as a nation. It's a big task we've charged our guests with tonight. The question we're simply going to ask them is, what is in healthcare reform for you and for me? Please join me in welcoming a policy associate of the Community Services Society of New York, Carrie Tracy. Good evening. Thank you for joining us. And also the Director of Programs and Outreach of the Medicare Rights Center, Fred Riccardi. Good evening. Thank you for joining us. Folks, don't forget, if you want to ask questions and learn about what your own situation might or might not be, don't hesitate to join us by telephone. Well, the Patient Protection and Affordable Care Act, the ACA. Carrie, we'll start with you. Will it make insurance easier to get, to keep, and to use?
Yes, it certainly will.
It's one check mark under the new healthcare reform. In what way?
Yes, it will. Well, it's estimated that in 2019, 32 million people in the United States who are uninsured will have new coverage. So there are a lot of different ways that people are going to gain coverage, and some people will be able to keep coverage or get coverage because of new rules that restrict practices of the insurance companies. There'll be a big expansion of Medicaid, so more people will qualify for public insurance.
That, of course, is going to be Fred's ball of wax to tackle tonight, but go ahead.
And there'll be subsidies for individuals to buy insurance, and there are already tax credits in place for small businesses to help buy coverage for themselves and their employees. And also, there'll be a new exchange. In every state, we'll be setting up an exchange, which will be a one-stop shopping marketplace so that people can go to the exchange, find out if they qualify for a public program or a subsidy, find out how to buy insurance, what kinds of options are available, and the plans will be more standardized. It'll be easier for people to compare apples to apples. Will this insurance plan be better for me or that insurance plan?
Let's start there at the exchanges. Using so many people in the Bronx and literally everywhere as an example, you don't have insurance, or you have an insurance plan that is ridiculous because it's too expensive and it barely covers you, and you've got a deductible that's out of whack, and then every time you try to use it, they charge you anyway, and you just can't navigate the plan. What will the exchange be that, as you suggest, would be an improvement?
Well, the exchange will be one place where people can go.
Now, when you say place, in other words, it'll be a list?
It'll be a virtual place. There'll be websites. You'll be able to call the exchange, look it up on the internet, and contact them, and they'll help you sort through. Apply. You sort of plug in who you are and your age and where you live and where you work, things like that, and it'll help you sort out the options and figure out what you qualify for and what would work best for you.
A marketplace.
A marketplace.
Like let's say you're looking for a plane ride somewhere and you're looking for airfare, you can go in and now you do that.
The goal is that it'll be like Expedia or
why,
a website.
Why
like that.
will that be cheaper and more efficient than somebody who might be looking for insurance right now? Like what's the benefit of having an exchange?
Well, there are a lot of rules for how insurance companies can sell plans on the exchange. and it will help sort out the plan. So people will be able to buy an essential benefits package. They'll be able to compare the benefits from one plan and the costs from that plan with other plans. But also there'll be subsidies for folks who make up to 400% of the federal poverty level. So a single person today earning up to $40,000 is about 400% of poverty. And so people will be able to get these subsidies that will help bring down the costs as well.
So the cost of the individual plans might be similar, but there will be subsidies for people who are
Right.
especially in need.
Exactly.
Is the notion, and maybe it's a simple guess on my part, that competition will make the exchange also a little better, much like airfares as well, is that you go on there and everybody knows that they're searching for the lowest fare, and so therefore, in order to get customers, it'll work.
Certainly there'll be competition, and it'll be real competition, because right now if you go to buy insurance, you can look at a website that tells you all the different plans that are available in New York State to an individual. But because the plans are so different and because the language is so confusing, it's really difficult to sort out, why is this plan more expensive than that plan, and how will this plan serve me better than another? So the government has already put up a website called www.healthcare.gov, where you can go and you can look at the plans that are available, and it provides some quality data, so you can tell this insurance company's had some complaints and this insurance company hasn't. But every state will have one of those websites, and it'll have a lot more information, and it'll be much clearer how the plans compare.
They will be organized by state. So in other words, if you're here in New York State, it might be different from our neighbors in New Jersey and Connecticut and everywhere else.
So the ACA, the Affordable Care Act, gives every state the option to start their own exchange. So that's really important. If these exchanges go online in 2014, but New York State has to decide this spring, during this legislative session, what that exchange is going to look like. And there are a lot of decisions to be made. The federal law leaves a lot of flexibility for states to decide who's going to run this exchange and what kinds of options are going to be available. And so New York State has to start making these decisions right away. And with the new governor and the budget crisis, people aren't really paying a lot of attention to these questions right now. And so at Community Service Society, we help lead a group called HCFANY, Healthcare for All New York, and it's a coalition. It's a statewide coalition over 100 consumer organizations. And we're trying to get people to start paying attention to the exchange. We put together 5 standards for what would make a good exchange, and we're trying to get people to pay attention and weigh in on that conversation.
Many people were hearing you say, gee, we're waiting for the state, in the state of New York especially, and in the Bronx are going to say, uh-oh, that means waiting for Albany to do something.
Right.
Unfortunately, that is part of what is going to be involved here for it to work in New York real well for New Yorkers.
So New York State is in charge. New York State is going to set up this exchange. And so, yes, we do need Albany to take action.
Got it.
We're hoping there'll be some public hearings. There need to be public hearings. People need to have a chance to weigh in on this. So people should make some calls. Call the governor, call their legislators, let them know that you care about them.
There's only maybe about 40,000 more questions to ask you, but let's bring our friend Fred into the dialogue. Seniors, many of whom use healthcare more than younger people, are of great concern and have also had some consideration in this plan. Talk about what changes there will be in their healthcare.
Well, for older adults and for individuals with disabilities who are on Medicare, have already started to see some changes as a result of the Act and of health reform. In 2010, many older adults who would go to the pharmacy to purchase their medications would often fall into something that's called the donut hole. And this is the period of time where an individual who has Part D coverage, which is a prescription drug plan through Medicare, through a private plan, no longer receives coverage for their drugs, and they have to pay the full out-of-pocket cost for those drugs. In 2010, individuals who fell into the donut hole started to benefit, and they received a $250 check as from CMS, from Medicare, as to put towards and pay for their drugs. So starting in 2011, we're really starting to see the elimination of the donut hole, and this is something at the Medicare Rights Center that we were really happy about and we advocated for. And so starting in 2011, prescription drugs will be cheaper for older adults who fall into the donut hole. Starting now, prescription for individuals in the donut hole, brand name drugs will be discounted at 50%, and generic drugs will be discounted at 7%. So it is a major savings that older adults will see just this year. So some
right
of the
away.
changes,
okay,
yeah,
so
right
that's
away.
The beginning. Give me something else in the structure of their plan or a problem that has been in essence, addressed through this process.
Yep. So fortunately, older adults, like other individuals, in 2011 also receive free preventive care services. So, for example, if you have someone who may have a family that's susceptible to breast cancer and she has to get a mammogram every year, previously on Medicare, she would have to pay 20% of the cost for the mammogram. This year, the mammogram is free. So many of these services are free for older adults. And so this is some of the information that may have been buried and people aren't too aware of, but there are some really great things in it for older adults on Medicare.
There is a huge segment of our population that says they're subsidizing for people with no insurance or people who can't pay. They're providing the $250 for the donut hole. They're doing all these wonderful things. Now what you used to pay 20% for is going to be free. Can we afford this? And is there a way that will pay for this that will work? As I understand it, there is kind of a roll of the dice, an assumption being made that you'll be able to save on certain costs because of the competition and everything else, and that will pay for this. Is that a roll of the dice? And are you secure that this won't be so expensive that in the long run it's a nightmare?
Well, in particular for Medicare, actually, health reform is strengthening the overall program of Medicare. There are going to take place some savings in different parts of Medicare. What we're really happy about, and there's good news, is there's a focus on preventive care, there's a focus on wellness, there's a focus on keeping people healthy. So in the sense of investing money into keeping people healthy helps prevent chronic illness and hospitalizations. But there is a little bit of a give and take, and there are going to be some savings in other parts of Medicare, and I can talk a little about those.
I guess that's right at the core of what the suggestion is, that it's a roll of the dice. You're just assuming that preventative care will mean you'll have to deliver less health care, and that will bring everybody's costs down. I guess it's an intelligent roll of the dice, but there is some risk there involved. Because what if, in fact, people still are unhealthy, then all of a sudden it's going to cost us all more? Is that a possibility?
Well, I mean, I think there's the outcome data shows that preventive care, and there's also a move towards better coordination of care. At the Medicare Rights Center, we have a consumer hotline where we receive phone calls every day from people who can't access their medication, who can't access their health services. And these are individuals who are really talking about the need for better coordinated care. And so there is information and studies out there that shows by coordinating care and preventive benefits help control some costs related to health care.
Carrie, I know you have something to say on this. Let's talk about the costs, and will this ultimately be too expensive, and is this, quote-unquote, Obamacare a big giveaway that could bankrupt the government and the system?
The thing that we can't afford is to do nothing, to not move forward. And so the Affordable Care Act, people have been talking for 60 years about how we're going to fix our healthcare system, and so there are a lot of ideas out there. And so when they put together the Affordable Care Act, they included many, many ideas for how to reduce costs, how to provide better care, and how to open up coverage to more people. And so the Congressional Budget Office, which is a very neutral agency that looks at issues that are before Congress, and they can't afford to be biased in one way or another, or Congress wouldn't work. And so they recently did a study, what would it cost to repeal all of the Affordable Care Act? And they found that it would increase the deficit between 2012 and 2019 by $145 billion.
And why would that be? Why would that be such a large number? And what about backing off it at this point would increase the deficit?
So it's a huge package of a lot of different programs. There are so many different programs that the CBO...
But our little half hour here in the Bronx is not going to be able to
We're not going to go through
address
them all. But these programs, there are a lot of different ways that they're cutting costs for care overall, finding savings in our healthcare system as a whole, and raising revenue in other ways. And so the way that health insurance works is that everybody puts their premiums or their money or their taxes or whatever into a pool, and then people take out of the pool as they need it. And if you have only a couple people in the pool and one person gets very sick, then the costs for everybody are very high. But if everyone in the country is in the pool, you're paying a lot less into the pool, and you can make much better decisions about how to spend that money and how to coordinate care and things like that. So overall, we should be much better off.
A federal judge today in Florida threw out ruled that the law was unconstitutional, saying this notion that you're going to require, and that's something you didn't fully mention yet, that we're going to require everybody to have health care, ruling that it was unconstitutional. having everybody buy into the system, is it in fact, do you think this is in fact, an unfair requirement? I know there are people I've seen on blogs all the time saying, hey, what if I don't want health care? Why do I have to buy health care? How does that concept mix into what we've been talking about?
It would be nice if we could decide, I don't want to buy health care, but no one can decide, I don't want to get health care this year. Nobody knows when they're going to get sick, when they're going to have an accident. The truth is, everybody needs health care at an unpredictable time. And so the system works for everyone in the country if everyone is paying into the system in some way and taking what they need out of it. And so I was in Washington, D.C. last week, and I heard people on both sides of the aisle, people who work for the Health and Human Services, people who are implementing this, and everyone said, this is the law of the land. We're moving forward. No one's moving backward. And so there may be debates about provisions. There may be some things that get changed. Of course, things are going to get changed. This is a first step. It's a good first step. It's a good roadmap, but it's not the last word on it. Social Security, when they first passed the law, it changed greatly within the next 10 years, within the next 20 years, within the next 50 years. We've got a lot of work to do, but we need to get moving forward, implementing this, and then think about how to fix it.
Let's go to the telephone. Did you want to add to that before we go to the phone? I know you were.
I mean, I think that
you was just dying.
I mean, I think that's a good point. As far as the Medicare program, every decade or so, there have been major improvements and there have been major changes to Medicare, and we see health reform as a great starting point, and it's something that can be improved upon. And we encourage all members of society, advocates, to contribute and join into that conversation. Just in the last decade, there have been so many changes, improvements to Medicare, and Medicare was a program that was controversial back in 1968.
Do you have something in the back of your mind you say, you know what, this needs to be changed? This would be something that we could ultimately look at as far as Medicare goes that would improve the plan that's been put on the table or that's been passed?
I mean, I think that consumers are looking for easier information to understand, access to better information.
So for you, it's an information thing.
It's partly information. It's also about making care affordable, accessible, helping understand the types of care one receives, coordination between a provider and specialists, understanding their tests.
Let's go to the telephone. Our buddy Mark from Pelham Parkway, who calls us all the time, is with us. Mark, how are you?
Gary.
Good. We don't have a lot of time. We have a lot to cover, so get to your point and let's do it.
Why is it that America, out of all the free countries, has some of the worst health care? When you look at countries like Canada, England,
Mark,
Iceland.
we got it. Give me a question.
Well, here goes the question. I think we would have been better with a single-payer system. This way you wouldn't have silly court rulings like we have, where you can say, well, we're going to pull out. And what you do is you increase the taxes and everybody's covered. Plus, when you look at all the free countries like Canada, England, Germany, Iceland, it includes dental as well. So it leaves a lot less where there's a chance. Everything seems to still be based on the fact that we're going to buy insurance from insurance companies. And that's the major problem, unless we get major competition.
Okay,
Because
Mark, thank you very much. Carrie, single payer, would that have been preferred? Although, of course, again, there's a whole other side that says you're out of your mind. This would be incredibly expensive to, in essence, privatize the whole system.
I think the question right now isn't would a single-payer system have been better. The question is how are we going to move forward? We've got a system. We spent 2 years debating this. The whole country got in on the conversation. We managed to pass some legislation, and now it's up to the states to move these exchanges and to implement the Affordable Care Act, and up to the federal government to keep supporting the states and making all these changes and enforcing the changes that have been. So I think it's a mistake to look back and say, could we have done it differently? I think the important thing is to move forward and really all work together to make the system that we have the best possible system.
Did you want to weigh in on this idea of single payer,
I just
because she basically didn't really. I mean, she said, "Look, we're not going there, so why even talk about it?" But it's an interesting. A lot of people.
Of course, it was an important debate and discussion, but now that we're at the starting point, I think it's important to look at some of the implementation, some of the rules around, health insurance companies. I know by 2014, Medicare Advantage, these are private health plans that offer Medicare benefits. By 2014, we'll have to spend 85% of money that's received from the government or from members on actual care. And so that money, which in the past may have gone to administrative costs or profits or marketing, really has to go back into care. So there are some improvements.
Carrie, let's talk a little bit about businesses and the reality of either people who own businesses or run businesses. Someone says, you know what, I like my health care. I'm doing pretty well with the company I work for. Number one, are they going to have to give it up? And number two, is there some consideration that businesses are going to have to handle what they do a little differently?
Let's see. People who have coverage that they like are allowed to keep it. A lot of consumer protections were passed and have already been implemented in September. One example is that children, in the past, adult children have been dropped from their parents' coverage, but beginning in September, if you're up to age 26, you can stay on your parents' coverage as a dependent. So there are some changes that will protect people more and make the coverage that they have work better for them, but people can continue to have the same coverage. One benefit of the exchange, and already the small business tax credits have already taken effect too. So people with small businesses can get up to 35% tax credit for
tax credit if they provide coverage for
covering their employees. Also, the exchanges a lot of small businesses have trouble finding coverage for their employees and their businesses, not just because of the cost, but because of the complexity. It's so difficult. If you don't have an HR department, it's hard to figure out how to make private
somebody who
insurance
runs a small store or a restaurant or something like that might want to, but says, I can't do it.
It's just too much.
Does this assist that
the exchange will be able to help.
So then
small
people
business
can go
owners.
into the exchange and purchase it.
Exactly. And they'll be able to aggregate with other small businesses around the state and get better coverage at a lower cost.
Some of the things that people have been wrestling with over time, and that is pre-existing conditions. People say, I like Fred was talking about preventative services, all those kinds of things. How will that be affected in this healthcare reform?
So a lot of rules went into effect in September, and one of those is that children with pre-existing conditions can't be denied. And in New York State, we already had guaranteed issue, which meant that people with pre-existing conditions could get coverage. They had to, if they applied for coverage, they had to get it. But one big impact of the Affordable Care Act is that it created pre-existing conditions pools. It provided grants to states to create pre-existing conditions pools. And so in New York State,
what does that mean, a pre-existing condition pool?
So in New York State, we've got the New York Bridge Plan. And the New York Bridge Plan is coverage at a much lower price than going into the individual market. Before, someone could go to the individual market and buy insurance from an insurance company directly, but it cost $1,000, $1,200 a month for an individual. And the pre-existing condition plan through the New York Bridge Plan provides coverage for, I think, $442 if you're downstate and $300 and something if you're upstate. You have to have a pre-existing condition, and really most people have a pre-existing condition.
Everybody has something.
I have one, and you have to have been uninsured for 6 months. So people who've been uninsured for 6 months and have been unable to afford care in the past will be able to buy insurance through that plan, and that will continue until the exchanges go online. And another advantage, or another benefit of the ACA that has already taken effect is the consumer assistance programs. There's funding in the ACA to set up consumer assistance programs in every state. And where I work, CSS, we run one of those programs. New York State's program is called Community Health Advocates. And so we work with community-based organizations all over the state. There are 24 community-based organizations. People can walk into them, give them a call, and ask for help. And they can also call our hotline, which is at 1-888-614-5401.
And we've put that website up on the screen, and people now can see the address and everything else. So that works out well.
So we've been able to help people. People call us if they need help figuring out their options. They don't know what they qualify for. Once people figure out what they want, we help them enroll in it. And once they're enrolled, we help them use that insurance. If they get a denial letter, we help them do an appeal. If people don't qualify for anything and can't afford any insurance out there, we'll help them find places to get discounted care or free care.
And so as the healthcare reform bill proceeds, there will be many people who say, look, I can't afford it. You got to be out of your mind. I can't add this to my budget. But through the exchange and through contact with organizations like yours, they will be able to get advice on how to do this. But they're going to have to do it. It can't be like, well, I'll just let it pass.
Right. So recently we heard from a family their daughter was 24 and she had Crohn's disease, which is a terrible, debilitating, difficult disease.
Right.
And she was uninsured. And so she called us and we were able to help her sign up for the New York Bridge plan for a month. And then January 1st, her father's insurance was renewed. And so the young adult coverage, she was able to go back on his insurance as a dependent. And so she was able to get
a happy story with, at least at this moment, a happy ending.
Yes.
Fred, let's talk about seniors. We don't have a lot of time, but talk about seniors, and they're all concerned about, it sounds good, but what do I got to do? How can they get information and find out about what is in this for them and what they're going to need to do?
So for them, for older adults and for people with disabilities who are looking to get information about the upcoming changes to Medicare, there are a few different places they can get this information. One place is the nonprofit organization where I work, the Medicare Rights Center. We are an advocacy and consumer organization where we help people understand Medicare, its changes, and some of their problems that they have. They can call our consumer hotline, and they can also go to our website, which is MedicareRights.org. Our hotline number is 1-800-333-4114.
This is a very important number for seniors. 800-333-4114. 4114. So seniors can pick it up even now and start talking about it.
And ask us questions from 9 to 5.
9 to 5, all right.
And in addition, they can go to CMS's website. They can go to Medicare.gov. They can call 1-800-MEDICARE. They can get information from their local state health insurance program.
And in that, I'm always concerned about individuals. In that they can say, this is my situation, and they can have somebody who can talk with them.
Yes.
Carry the number for the Community Service Society of New York, and so that they can get a booklet like the one I have here and all that other information.
So the helpline for
Yes.
community health advocates is 1-888-614-5400. And that very presentation is on the HICFANY website, www.hcfany.org. And if you go there, you can find updates on our blog about what's going on around the country and the state. You can sign up for updates. You can learn about all kinds of
Clearly, never enough time to talk about health care, but this is the booklet that she was referring to, and it's on all those websites. To Carrie and Fred, thank you so much,
Thank
at
you.
least for getting the dialogue started. I just think it's vital that people really understand what's in it, because you hear so much out there, and we appreciate that you've given us some facts to deal with. Thank you so much.
Thank you.
Folks, if you have further comments or questions on anything you heard on tonight's show or anything going on in the Bronx, then email them to us at BronxTalk@hotmail.com, and we'll read those on the air during a future edition of our program. Archives of the show are available at BronxNet.org. You click Bronx Talk, which is on the lower right-hand navigation bar. Now, next week should be a really interesting show, like all our shows. We turn our attention to the controversial American Idol piece that riled up so many in the Bronx, and also comments by Fox News' Glenn Beck, who talked about Co-op City on his program. A show about the image of the Bronx in the media next Monday night at 9 on Bronx Talk. Now in its 17th year, one of the longest running TV talk shows in New York City. Thanks to producer Jane Folloro, director Michael Arias, and our cast of thousands who are all around us here in the studio. And thanks to you.